Dr. Brian Paris here with our do-it-yourself DIY programs for you to work on your spinal health, your posture, your overall body health. So one of the key components to keeping your body healthy over a period of time is moving the thoracic spine. So what is your thoracic spine? You've got your neck, which is your cervical spine, your mid-back, which is your thoracic spine, which is what we're talking about today, and my lumbar spine is my low back. Now, we've already discussed some of our hip stretches. We know that our hips need to be mobile, and what should be stable is our low back and our core. What actually should be very mobile is our thoracic spine. The reason is because it houses the lungs, and it's also a transition point between my neck and my low back. So we have our dowel that we made from Lowe's or Home Depot. I'm not getting promoted here on that one. This is the most simple thing you can do to start moving the thoracic spine, is rounding forward. It's okay for the head to come forward from this perspective. You can see where my back arches forward, and then I'm gonna move it here. Now, the key component here is that I'm keeping my core engaged while I'm doing this. I'm not overarching here. This is something that's focused directly on the thoracic spine. So I'm here and here. Here and here. I'm gonna show you how to do it from a chair in just a second. Okay, so we're gonna show you how to move the thoracic spine from a seated position here. Same thing, so my feet are flat on the ground, my hips are squarely on the chair. I'm moving my thoracic spine so that I get mobility in this direction here. Here and here. So we're going to continue with thoracic spine mobility, but I'm going to use the shoulders as a way to get the thoracic spine mobile. I like to first make sure when I'm in that neutral position, my palms are facing outwards. Again, it's a reminder and a signal that if my palms are facing sideways or here, my posture is rolling forward and we want to be in a more upright position. So the first thing we're going to do, and this just lights up my body. I feel good when I'm doing this. I'm going to roll the shoulders back. And I'm gonna roll the shoulders forward. Pretty simple. Then I'm gonna roll the shoulders, and I do this exaggerated so that what's happening, you can probably see, I'm trying to keep my spine stable, but it is moving and twisting as my shoulders are going in this direction, in these both directions. Okay, I'm always shaking my hands out. You'll see me do that. So this just gets me awake. Now, this one's a little more challenging. Again, I'm starting in this neutral position. I'm gonna raise one shoulder and bring the arm underneath and stretch in this direction. Now, I can stretch out further here. As you can imagine, my whole spine is twisting in this dimension here. And I'm turning my head in that direction. And then I'm lifting my shoulder up and coming back out. I'm using the next shoulder here, bringing the arm underneath and reaching. So if you're doing it fluidly, here's what it looks like. And again, ideally it would be better to do this standing. I am doing it from the seat because I know a lot of us have a harder time standing, but the easier way to do this is just simply without lifting the shoulders. You can just turn the body this way. You'll see that I'm keeping the core engaged here. Most of my motion is coming from the top portion of my spine here in the thoracic spine, so we're getting that mobility there. And I'm looking. Okay, there you have it. Next, imagine that you're holding a teacup. I'll show you from the front here. If I were holding a teacup, my teacup's definitely gonna spill, but I'm gonna do my best. I'm gonna do one at a time here where I'm holding this teacup and I would be moving this in a direction where that teacup wouldn't spill. I'm gonna advise not to try it with a teacup and use a ball because it's a lot easier. We do that with both hands. And the elbow drives over the head this way. I'm not gonna move through pain. If I do feel pain, I'm gonna decrease that range of motion, but I am using these to get fluidity, especially like what we talked about in my thoracic spine. So without a ball, I like to do it with both hands in this direction here where they twist. And again, I would definitely be spilling the tea. So I'm doing the best that I can. And it's okay where I'm bending my body in the lower portion, just getting some mobility in my spine. I can end and then combine that with what we did earlier in thoracic flexion and thoracic extension. So you have some really good movements here for your thoracic spine. This, in my opinion, is the most important element to keeping your body healthy over a long period of time. All right, so we got some more thoracic spine and shoulder mobility. From the standing perspective, my base is really firm. I can bring my feet a little wider apart for this one. My knees are relaxed, core is engaged. With this one, I'm going pretty wide on my grip here. Now, we're going straight overhead. This, for some of you, may be tough enough, and that's it. That's as far as you need to go, just from this range of motion forward to here. The wider your grip goes, the easier this is, where you're bringing this all the way back and holding it in this position. So you can see where this really opens up the chest and you can bring it back forward. Now, in addition, if you don't have this dowel, most of us do have towels. So I can take a towel and just grab that as a wide grip here and stretch. That was a little harder because I can't go as wide. It's tougher on my shoulders, okay? The next one is to actually work one at a time. And this is similar to the teacups, which I showed you earlier. So we're starting out in this position. The hand goes over one at a time, and we're back in this position. And then the next hand follows back around to the front. We can go in both directions. So I'm going over with the right, back to that position, left follows in front. So if you're doing it fluidly, it just really wakes up the shoulders and the thoracic spine. If you're grabbing your towel from very far grip out here, give yourself some ease. Same perspective, one hand at a time, really opening up the body and breathing. And this is just another movement that you can add to your daily arsenal of movements. So we're gonna work on some neck stretches. And again, if you've had surgery before, or if you're having episodes within the neck, this is not the right stretch for you. These are basic movements for you to get your body, and specifically your neck, more fluid, more open, more mobile. Firstly, I'm gonna keep my tongue in the roof of my mouth. The reason for that is when my tongue is off the roof of my mouth, that fires off the digestive aspect of my throat and neck. Breathe through the nose so we get good filtered air and we start to fire off that rest and digest parasympathetic nervous system. So simple, chin to the chest. And you're gonna feel a stretch all the way down through the traps into the mid-back, then back to neutral. You can do just simple range of motion here where you're turning. I like to go a little bit more where I'm turning and I get two little turns there. So 1, 2, 1, 2. There really is no set number. Whatever feels good, whatever feels juicy, whatever gets your body moving and open and mobile. Next one is just ear to your shoulders. When I stretch, I like to get a little bit further when I'm bending my ear to my shoulder, and I can bring my arm out and get a little stretch here. Okay. And to the other side, you can just do a lateral lean, ear to the shoulder. Try not to get as much of a twist, but you want your head to just completely tilt. Get a little extra of a stretch. I can open my arm up this way. My favorite one is looking down into as if I had a pocket here. So I'm looking down and then turning and grabbing my head. And again, it's just a little extra of a pull, just so you can feel some tension in those tissues. A little extra of a pull. And feel some tension in those tissues. Good. Last one, and if you have neck injuries like me, or just some arthritic changes in the neck, again, if this does hurt or causing pain or discomfort, I'm gonna say stop immediately. But chin to the chest, nice, easy circle around. I don't know if my microphone is picking this one up, but a lot of crunchies here. Good. Okay, that's some basic neck range of motion here.